Welcome to this Ubuntu Project video facilitated by Zentertainment Enterprises. Be sure to like and subscribe if you learned something new. Now, onto the video.
You know what I was thinking? I was thinking, how do our ideas about social identities affect our expectations of ourselves and of other people? What exactly would be different from our lives if we did not have to stay in the confinement of our race, our age, our gender, our sexual orientation, our whatever, fill in the blank? Would you apply for that job? Would you start that business? Would you ask that cute guy or girl out on the date? The very definition of social identities implies like the roles or groups that individuals place themselves in to have like a sense of belonging. So we create groups and roles to belong, but yet we feel very lonely. Hello there. Hi there. Hi, how are you? Yes, you. My name is Damilola Adesina, and I'm a licensed professional counselor. And I'm also a first-generation Nigerian American. And this session is called Intersecting Experiences Addressing Mental Health Disparities in Marginalized Communities. So in this session, we are going to identify the disparities that exist in mental health amongst marginalized communities. And we're going to talk about the intersection of how your social identities contribute to the lack of resources and care, right? But before I get into how we're going to talk about it or what we're going to actually do, I want to define what a marginalized community is. As you know, I'm not all talk. You gotta talk the talk and walk the walk at the same time. So now that we have the definition of a marginalized population out of the way, I want to start by sharing with the story, because to be honest, how else am I going to spend the next 15 minutes if I can't tell y'all a story? And this is a personal story about my experience of belonging to a marginalized community and how the mental health disparity impacted me, I guess, so to speak. And this story that I'm telling you is coming from my guided journal called Embracing Radiance. The link is here below. I always wanted to do that. Y'all see that? Is it up? The link is here below, or click down below. For the month of May, my book is 50% off. So if you always wanted to get it, which I mean, I'm sure you have been dying to get your hand, it's a guided journal. And the guided journal kind of helps you to uncover your authentic self. Anyhow, so link below if you want it. But I'm going to be reading from my guided journal to share with you some of what I experienced and what possibly led to some mental health issues that I would say growing up. So here we go. Growing up in a tranquil, small rural town with its singular Walmart and McDonald's, life seemed simple yet connected. Whenever I strolled through Walmart as a teenager, familiar faces always crossed my path. There was just no obscurity in this close-knit community. This town also had one middle school and one high school. When you transitioned from 8th grade to 9th grade, you had to select the courses in the track that you would take. The options were technical prep, which would grant you courses that could get you into technical school or community college, or you would choose college prep, which would guarantee courses that would prepare you to apply and complete prerequisites for a 4-year college or university. By the time I was in 8th grade, I had adopted the reputation of being labeled the smart black girl, which unfortunately I wore proudly. However, this label shielded me from the full force of challenges that others face daily. No one looked at me with disdain. I was trusted among teachers to take care of mindless errands, and I was well known. I didn't have to try hard, try like other black women have to try today to be accepted. I simply existed. Of course, I wanted to continue this reputation in high school. I mean, who wouldn't? When I selected college prep courses, I quickly noticed that my schedule was changed to tech prep classes. I informed my mom of this change and she went with me to the school to talk to the counselor who oversaw my schedule change at the time. Put my daughter in college prep classes, my mom demanded. I also want to be an honors track, I added. The counselors, whose name slipped my mind, and maybe for good reason, looked at me and said, honors track is too hard. She pressed in and she said, I don't think you'll be successful there. For the first time, those words casted a dark shadow over me, and I began to doubt my abilities. My confidence was shattered. Up to that point, I never had an adult in the school system blatantly tell me what they thought I could accomplish and achieve. But later I realized it was because I hadn't gotten to high school yet. I could still see the look of disapproval and doubt in the counselor's face as my mom continued to state my case and defend why this is the right decision for me. I questioned my accomplishments were just not enough to override such doubts. I remember thinking, doesn't she know that I'm really smart for a black girl? Did she not ask my 8th grade teachers about the grades I made or the errands they trusted me with? I mean, surely if she would just speak with them, then she would have not had so much doubt about my capabilities. My young mind grappled with the realization that my skin color often spoke louder than my abilities. The meeting ended with the changing of my schedule to college prep reluctantly and adding me to honor courses for the rest of my high school career. I was satisfied, but what I did not know was how this moment would forever change my work ethic, my outlook of myself, and the fear of failure. This became a turning point that resonates deeply in my journey. Yes, as a first-generation Nigerian American, I was expected to go to college. My mom made it clear that when I turned 18. I was not welcome back home, and I must either go to work or go to college. She also made it clear that she was not paying for my college, and I would need to get scholarships or take out a student loan. Suddenly, I felt the weight and pressure of the world. My desire to prove myself turned into an obsession for perfection, setting the stage for my drive to excel. I am special. I am smart, right? I can remember being in Algebra 2 and the teacher who was the superintendent's wife passed back grades after our first test. I made the highest grade on the test and she was shocked. While these were not the exact words that came from her mouth, I've seen this look before. It became a familiar look of, you're smart for a black girl. I also remember in Algebra 2, my teacher would not allow me to work with anyone else because I was too advanced for the class. I made hundreds on everything. She would sit me in the front center of the class. No one sat beside me. I did not mind. I felt special and important. Math simply came easy to me. If you followed the rules, it was a guaranteed win, right? But not for this black girl. These memories cast a light on a recurring theme, an expectation of excelling tinged with the shadow of being the smart black girl. My story reflects how external perceptions can mold our actions, often leading us to conform to others' expectations. Just in case you missed the point, I'm going to give it to you. In my story, my college counselor or high school counselor's perception of me impacted the resources that she thought that I could have or handle. Her perception would then go on to impact the view that I have of myself and also create or snowball into other mental health issues such as anxiety. I would call myself, I had like functioning anxiety or functioning depression, just being someone who struggled a lot with perfectionism and wanting to get things perfect because I had a fear of things being taken away from me. So because of her perception, it created a perception of myself, which then impacted my mental health, right? And this entire section, we're talking about how our experiences impact or how the experiences of marginalized communities show up when we think about mental health and their inability to be able to receive the right access and the resources they need. So I want to continue on to show you how, again, like diving deeper beyond just like my experiences and give you some statistics around the disparities of mental health amongst different marginalized groups. And by marginalized groups, I'm specifically going to be talking about women, people in the LGBTQIA community, people who are disabled, people who are of the BIPOC community, people who have low socioeconomic status, people who are immigrants and refugees. These are the groups of people who I'm specifically identifying when I talk about marginalized. So in the next few slides or a few, whatever I'm going to put up, you're going to see the stats there. Here are some stats that arrive from the Agency of Healthcare Research and Quality, as in, I believe, in 2002, as it relates to mental health in marginalized communities. So in 2002, 23.1% of US adults, that's about 59.3 million, experience a mental health condition. One of five of these are women. So there's a higher prevalence of mental health in women than men. In 2022, multiracial adults were more likely to experience a mental health illness than the previous year. 50% of adults who identified as lesbian, gay, or bisexual experienced a mental health condition in 2020. And we all know in 2020, the pandemic had a huge factor as to why the increase in mental health illness was prevalent. 42% of US adults with a diagnosable condition in 2023 reported that they could not receive or access to treatment. And then 93.5% of adults with a substance abuse disorder did not receive treatment in the past year. And we can make conclusions as to why this is the case. Considering the statistics that I just reviewed for you guys, I want you to consider like two things. One, what do you feel like are underlying factors that contribute to the disparities in mental health amongst marginalized people? And two, what factors do you feel cultural competence and inclusivity play in the disparities that we see among marginalized people? Again, I don't want to insult your intelligence by spewing off things that you may already know, but it's really important to me that by the end of this session that you and I have the same level of understanding as to what truly are some barriers that people who are in the marginalized communities face when it comes to mental health. And goodness, looking at this slide, there's a lot of errors, so forgive me for that. But one of the first ones is a lack of insurance or underinsured. There's stigmas in the mental health among certain minority groups and cultures. There's a lack of diversity among mental health care providers, which then leads to a lack of culturally competent providers. Language barriers is also huge, and a distrust in the healthcare system, just considering how the healthcare system treats people of certain groups, and then just inadequate support for mental health service as a whole. Because, I'm not all talk. You got to talk the talk and walk the walk at the same time. So I don't believe all hope is lost, right? Yes, there are some huge numbers that can feel jarring, and at times it can feel hopeless, but all hope is not lost. There are several things that I want to suggest to you, things that you're kind of already doing and may not even be aware of some community-based approaches to addressing some of these disparities that we see in mental health in these marginalized communities. Number one, community education and advocacy. Watching this video, participating in the Ubuntu Project with Entertainment Enterprises, signing up and registering for these sessions or sharing them, that is your way of educating yourself and educating the people in your circle. And if those people share and so on and so forth, then we are now educating a wide range of people. Secondly, increasing your level of cultural competency when it comes to services. So maybe you are a mental health provider. I would charge you to increase your knowledge on the cultures and provide language translations for people that you may serve, but maybe you're not in the healthcare, etc. Maybe you need to seek out people who are culturally competent so that you can ensure that you're getting adequate services. I'm not saying that people of other backgrounds can't, but it's a culture situation. It's a culture shift, so to speak. And last but not least, I would highly suggest collaborating and partnering with organizations who are trying to help marginalized groups and communities like shorten the gap or lessen the gap when it comes to mental health. Whatever that may look like for you. Again, maybe you are somebody who cannot be heavily involved, but you can give. So financially supporting these gives, or you can be the volunteer of that group, or you can share, or you can talk about it. These ways may feel small, but they are mighty, and all of us do like one small thing over a period of time. It can make a really, really huge impact. So last but not least, before I go, I'm going to be leaving you with 2 resources or access to resources that will be in the description below. One of the resources is going to be a link to my guided journal. Again, that guided journal is 50% off for the month of May for Mental Health Awareness Month. So I strongly encourage you, if you're a person that is looking for a way, on how to uncover your authentic self, that is a great resource and tool that I utilize with my clients consistently and on a regular, and has already received a lot of great feedback. And secondly, the second tool that I created is a mental health map, reflection, just really kind of understanding like where you are mentally and what, disparities maybe that you've currently faced, and walking you through how you can then persist and break some of the barriers that may be present in the world. So I'm just going to create a little self-awareness, but make it individualized for you so that you can kind of walk away with something meaningful. So guys, we did it. Thank you once again for allowing me to journey with you, or journeying with me, or we just got together and we was riding, we was rolling. So now we are done. Dun, dun, dun. So until next time, bye-bye.
Please be sure to like and subscribe and hit the notification bell to know when we upload a new video.